Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Ureteral Disorders. Introduction. Ureters are long tubes that carry urine from each kidney to the bladder. There are many disorders that can affect the ureters. Ureteral disorders can make it hard or painful to urinate. They can cause extreme pain in your back and side. Some ureteral disorders can cause blood in the urine. This program explains ureteral disorders. It covers common symptoms of ureteral disorders as well as treatment options for common disorders. Anatomy. The urinary tract is made up of organs that make and release urine. These include the kidneys, ureters, bladder, urethra. We have two kidneys. The kidneys continuously filter the blood and make urine. Urine passes from each kidney into the bladder through a long tube called a ureter. Your bladder is a hollow organ in the lower abdomen. The bladder stores urine until it passes out of the body. When your bladder is full, the nerves around your bladder tell your brain that you need to urinate. Urine leaves the bladder and travels to the outside of the body through a shorter tube called the urethra. Ureteral obstruction. Ureteral obstruction is a condition that affects the flow of urine from the kidney to the bladder. This can be caused by kidney stones, tumors, and other damage to the kidney. Ureteral obstruction happens when organs in your body press against the ureter. Common causes of ureteral obstruction include gastrointestinal diseases such as Crohn's disease, lesions or tissue damage in the urinary tract, pregnancy. Ureteral obstruction can also happen if a kidney stone or tumor blocks the ureter. Ureteral obstruction often has no symptoms. Sometimes it can cause sharp pain in the back or side of your body. Other symptoms of ureteral obstruction include bloody or cloudy urine, fever, nausea or vomiting, trouble urinating. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases. Ureteral obstruction can be hard to diagnose. Your healthcare provider will ask you about the medical history of you and your family. He or she will perform a physical exam. Ureteral obstruction is usually diagnosed through imaging tests. Imaging tests let your healthcare provider take detailed images of the inside of your body. These tests include CT scan and MRI, intravenous urography, ultrasound. Treatment for ureteral obstruction tries to open the ureter and drain the kidney of urine. This is usually done by placing a stent, a hollow tube, into the ureter. This opens the ureter and lets urine drain from the kidney to the bladder. Ureteral obstruction also can be treated with a nephrostomy. A nephrostomy uses ultrasound images to insert a catheter directly into your kidney through the back to drain the urine. A catheter is a plastic tube that lets liquids leave the body. If the obstruction is caused by a tumor or cancer, then treating the cancer or tumor and shrinking it or taking it out surgically can help care for the obstruction.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Ureteral stones. Ureteral stones are kidney stones that have moved to the ureters. These stones are hard masses of urine formed in the kidneys. Ureteral stones are formed in the kidneys when crystals in the urine stick together and become large enough to form a stone. Crystals are solid forms of chemical compounds in the urine. Kidney and urine infections may also lead to ureteral stones. Kidney and ureteral stones can be painful. They can cause sharp cramps in the back, side, and lower abdomen. This pain can interrupt your normal activities. Kidney and ureteral stones can cause a frequent urge to urinate. You may not feel that you have completely emptied your bladder after you urinate. Other symptoms of kidney and ureteral stones include bloody or cloudy urine, difficulty urinating, nausea or vomiting. Sometimes, kidney and ureteral stones happen with no symptoms. This is rare. Ureteral stones are often diagnosed with CT scans or an X-ray. Your healthcare provider may perform a blood test to check for infection or high levels of chemicals that may cause the stones. Treatment for kidney and ureteral stones depends on the size and location of the stone. You may be able to pass the stone without treatment. You may be given medication to help with the pain. You should drink a lot of fluid to help flush the kidney. Sometimes medication is used to help dissolve the stone. This can take a long time and may not be useful if your stones cause severe pain. Drinking a lot of water and exercising can help prevent kidney and ureteral stones. People who have had stones should limit the amount of calcium and sodium in their diets. This can help prevent kidney stones from happening again. Ureterocele. Ureterocele is when one part of the ureters becomes enlarged and swollen. This happens in the part of the ureter closest to the bladder. Ureterocele can limit the flow of urine and cause urine to become backed up in the ureter. This can cause kidney infections and kidney stones. Ureterocele is a birth defect. It is usually diagnosed by the age of 2. It is more common in girls than boys. Ureterocele often has no symptoms. It can cause pain in the side and back. Sometimes ureterocele can cause excessive urination and blood in the urine. It can rarely cause a fever. If it is not treated, ureterocele can cause kidney damage or kidney failure. It can also cause infection. Ureterocele is often diagnosed with an ultrasound. It may be diagnosed before birth. Ureterocele is sometimes diagnosed through a test called a voiding cystourethrogram, or VCUG. During a VCUG, the bladder is filled with dye through a catheter. This dye lets X-ray images show the bladder and ureters. Sometimes ureterocele is diagnosed through MRIs or CT scans. Ureterocele can be treated with medicine, stents, surgery. Antibiotics can help prevent infections if surgery cannot be done right away. Your healthcare provider may recommend placing stents in the ureters to treat ureterocele. Stents open the ureters and allow more urine to be drained. Surgery is often used to treat ureterocele. The surgeon removes the ureterocele and attaches the healthy ureter to the bladder. Rarely, part or all of a damaged kidney is removed during surgery for ureterocele.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Ureters are long tubes that carry urine from each kidney into the bladder. There are many disorders that can affect the ureters. Ureteral disorders can make it hard or painful to urinate. They can cause extreme pain in your back and side. Ureteral obstruction is a condition that limits the flow of urine from the kidney to the bladder. This can cause kidney stones, tumors, and other damage to the kidney. Kidney stones are hard masses of urine in the kidneys. They are made of tiny crystals. When kidney stones leave the kidney and enter the ureters, they are sometimes called ureteral stones. Ureterocele is when part of one of the ureters becomes enlarged and swollen. This happens in the part of the ureter closest to the bladder. Ureterocele can limit the flow of urine and cause urine to become backed up in the ureter. Treatment for ureteral disorders depends on the nature of the problem. Most people who have ureteral disorders are able to resume their normal activities after treatment. Thank you for using Explain.